I'm Michelle De La Luz, Executive Director of the Fifth Avenue Committee, and I do appreciate everyone coming to be a part of this panel, which then leads into our awards and benefit reception later this evening. So the theme for both the panel and for the event is building a just and inclusive city. And the panel topic is inclusive growth in New York City, making it a reality. And I think, for those of us, and I know almost everybody in the room so far, I think we know how challenging a topic that can be. And so we're really fortunate to have a great group of panelists who can help lay out those challenges, especially amid the fact that we have a growing city population, and it's expected to continue to grow by more than 750,000 people in the next 20 to 25 years. And of course, the backdrop for that growth is the fact that we've had an affordable housing crisis for more than 7 decades, the fact that we have an all-time high in terms of the number of homeless individuals and families that are in the city, that we have folks paying an unprecedented amount of money towards rent, being doubled up and tripled up, and those pressures don't just impact residents, but they impact businesses. And we've seen a lot of longtime businesses, industrial businesses, also impacted by this growth. So, as a nonprofit community development corporation, Fifth Avenue Committee's mission is to advance economic and social justice. And we understand that these things are all interrelated and that we need to balance a number of things as we move forward. But for us, it really is about always having a lens or a filter that thinks about these challenges from the perspective of economic and social justice, and quite honestly, racial justice. Because, often the downsides of growth, the negative impacts of growth are often borne disproportionately by folks of color and low-income communities, and the benefits of growth are often, bestowed upon or benefit other groups that have been in power for a long time. And so, certainly as the de Blasio administration, one of the most progressive local administrations in the country, is committed to a different paradigm. And I think really what we want to do is have a conversation about that paradigm, have a conversation about where the tensions are, really where the rubber meets the road from the perspective of a couple different folks. So we're really fortunate to have a distinguished panel and moderator for today. We have Jessica Yager, who's the Executive Director of NYU Furman Center and also a FAC board member, so we're certainly happy to have Jessica. We've got Joan Byron, who's the Program Director of the Neighborhoods First Funders Collaborative, and prior to that, I think many folks know Joan from her more than 25 years of experience at the Pratt Center for Community Development, working alongside communities to realize a number of visions that communities have for neighborhoods. We have Benjamin Dulchin, who's the Executive Director of the Association for Neighborhood and Housing Development, which is essentially the nonprofit trade association of nonprofit affordable housing developers and advocates, and industrial development advocates, and in fact is a proud member of ANHD. We have Purnima Kapur, who's the Executive Director of the New York City Department of City Planning, and she's a veteran DCP staffer despite her young years, having previously directed DCP's Brooklyn and Bronx offices. And we have Dr. Aletha Maybank, who's the Associate Commissioner at the New York City Department of Health and Mental Hygiene, and serves as the Director of the Center for Health Equity. And they're employing a racial justice perspective in the agency's work. And I just want to mention that she has to leave a bit early. And so if, we want to make sure that we really cover the pieces of the presentation that she's here for while she's here. And you see that Maria Torres Springer, CEO and president of the city's Economic Development Corporation, was expected to be on the panel and sends her regrets. Unfortunately, the fire that happened underneath the elevated rail in East Harlem has meant that she's been called into action to help address that particular situation. So she does send her regrets, but I believe we have a number of folks on the panel who can try to help cover a number of the points that she may have covered, and bring up a number of issues about the interconnectedness between industrial development policy, and certainly she has the perspective of someone who's a former commissioner of SBS as well. So I just want to ask everybody to please silence your cell phones. I'd really appreciate that. And with that, I am going to turn it over to Jessica, and again, welcome everybody here.
Hi, everybody. Thanks, Michelle. Okay. So I'm going to start us off with a brief presentation to set the stage for our conversation here today. So a lot of what I'm showing here is from a report that we at the Furman Center released last week, our annual State of the City report. I'm just going to give a few slides that hopefully will be helpful for the conversation. So next slide. So New York City's population is at an all-time high, as you see here on this graph. And in 2015, the number climbed to over 8,550,000 people. Next slide. And of course, the city's economy also continues to grow. As more and more people have moved to the city in recent years, rents have risen, but incomes have not kept pace. Between 2005 and 2014, median rent increased by about 15%, while median renter income increased only slightly, by about 2%. Next slide. As a result, the city has seen a loss in the share of recently available units renting at levels that are affordable to low and moderate income households. Consider a renter earning 80% of the area median income, or $67,000 for a family of 4. In 2000, 64% of the rental units on the market would have been affordable to this household. But by 2014, that same household could only afford about 43% of the rental units on the market. This is despite the fact that nearly 2/3 of renters in New York City have incomes at this level or lower. Next slide. So in our report, we looked at citywide changes related to affordability and other neighborhood conditions, but we also report on changes in gentrifying neighborhoods. So I want to say a word about what we did before I go on. So we define neighborhoods as gentrifying. We started by looking at incomes that were lower income in 1990, and then looked to see which of those incomes have seen above median increases in rent since then. So we define lower income neighborhoods as neighborhoods with an average household income in the bottom 40% of the city's neighborhoods in 1990. So that's all the neighborhoods on the map that are either light blue or dark blue. And then within that group, we classified a neighborhood as gentrifying if it saw above median rent increases between 1990 and 2014. And those are the majority of neighborhoods that were lower income in 1990. It's 15 out of the 22 neighborhoods, and those are colored in the darker blue on this map. We classify the other lower income neighborhoods as non-gentrifying. And finally, the neighborhoods that were in the top 60% of the income distribution in 1990 we call higher income for the purposes of this study, and those are gray. Next slide. So the reductions in affordability that we have seen citywide, which I showed earlier, were particularly pronounced in neighborhoods that we classify as gentrifying. For example, next slide. For example, consider again a household earning 80% of AMI. In gentrifying neighborhoods, this household could have afforded 70% of rental units on the market in 2000. By 2014, the share of affordable units dropped by 30 percentage points, which is a very dramatic loss of affordable units. Next slide. Rents in the neighborhoods that we classify as gentrifying increased by 34% in real terms between 1990 and 2014, which was significantly more than rents increased in non-gentrifying neighborhoods and in higher income neighborhoods. And notably, most of that rent growth took place after the year 2000. Next slide. As for racial composition, gentrifying neighborhoods have become somewhat more white, going from 19 to 21% white, even as the city as a whole has become less white. Next slide. And gentrifying neighborhoods saw a larger decline in Black population share than the city as a whole. Next slide. Okay. The racial and ethnic change in gentrifying neighborhoods have brought them closer to mirroring the race and ethnic composition of the city. In 2010, gentrifying neighborhoods remained less white and Asian and more Black and Hispanic, but they looked more like the city as a whole than they did in 1990. So there's a lot more to this report, and I didn't want to take up too much time talking about this, but you can check it out on our website, and if anyone wants a hard copy, just let me know. But now, with that, I'm going to turn to the panel, invite the panelists up to the table. Great. Okay, thank you all for being here today. So we'll be sure to save time, about 15 minutes at the end, for questions from the audience, just so you know, so write your questions down. So our topic today is inclusive growth in New York City, making it a reality. Before we turn to a discussion of how to make it a reality, though, I wanted to start by asking all of our panelists to describe that goal. What does inclusive growth look like in a city like New York? So I'm going to start with Joan.
I think an inclusive growth in a city like New York, it would be a baseline. Everybody, no matter their race, no matter their income, can live in a neighborhood where they have what they need to thrive, physically, economically, culturally, but also recognizing that we're not starting from even, we're not starting from a level playing field, and that since inequality is so bound up with geography in New York and with our history of segregation, inclusive growth has to mean that we have policies that intentionally and systemically and significantly move to reduce, for example, the crushing inequity in the burden of housing costs that people are experiencing, that are driving people into living situations that are unhealthy and untenable. And the racial and economic segregation that pushes people of color and low-income people into neighborhoods where they're isolated from transportation, they're isolated from economic opportunity, where their kids go to bad schools, where they bear a disproportionate share of the environmental burdens that actually are imposed by our growth. So inclusive growth is not only the place we aspire to get to, but the set of policies and practices and programs we put into effect to reverse the forces of inequality.
So can I get my first slide up? So inclusive growth kind of should look like that. And that's a hard thing to do. So that's people generally think of sort of income distribution as sort of a bell curve, that there's a few people, sort of really poor, and then you got a lot in the middle, and then you have a few that are really rich. Actually, income distribution in the city looks a lot more like this, where the heavy weight of the population is clumped over towards the really low-income side, and then it trails off from there. And so I think this sort of, for us then, this question of inclusive growth is a really urgent one, because the city's at a moment where both in its affordable housing policy and its economic development policy, it's really looking to harness the energy of the private market, necessarily, correctly, right? That's the moment we're in, is to harness that energy and to use city incentives and city policy to better encourage both economic sectors and housing development that meets the needs of the population. But it is on its own, the private market really is not going to build for the lower end and naturally sort of wants to build for the higher ends. And so this dilemma that the city then is left with is, how do we use the tools that we have to energize, to incentivize the market, to create more jobs, to create more opportunity, to create more housing, but do so in a way where it is actually inclusive of the population that lives in the city. And this is, I think, where sort of the central tension comes from. We'll sort of, I think, get into more of this throughout the panel, that often when sort of the majority of people who are really sort of on the lower income side of the spectrum, when they think about city incentivized growth, they see a lot of it happening from sort of, in housing from sort of 60% of AMI and up, and often at the much higher realms of sort of professional job development. And so they say, growth for whom, inclusive for whom? Is my neighborhood, are my neighbors really represented in this plan for growth? And What's tricky is that this is the urgent issue. This is the thing which we have to get right to be an inclusive, to be an equitable city. And yet, the de Blasio administration in some way needs to create a lot of the tools from scratch. These questions of how do you harness the energy of the private market to build really low-income housing, that is hard to do. It is necessary. The policy is tricky. It can be more expensive, but it is hard to do. And so the de Blasio administration has sort of been pushed into a position where they're trying to sort of shape these new tools from scratch. Similarly, in economic development, which we'll sort of talk about later, there's, they're sort of shaping some new tools, some new approaches from scratch. And it is hard to do, but it is no less urgent or necessary just because it is hard. And I think that's what a lot of the inclusive growth struggle and sort of the policy demands on this administration are.
So I think echoing some of what has been said here, I think from the city's perspective, as Ben alluded to, this mayor came into the office with issues of equity and inclusiveness at the core of his really his mandate, and we've been charged with putting that into practice. From our perspective, inclusive growth really is first the city and all of us recognizing that the city is growing no matter what, right? There is no sort of, we are growing in population, we are growing in overall economy, our jobs are growing. So many ways the city is well positioned to sort of be at a point where we could be a very vibrant and a more inclusively wealthy city. So how do you get to that point? At the same time, as your slides showed, there is really this mismatch between where people's incomes are and where the rents are today. On a citywide basis, on a neighborhood-wide basis, as we think about growth, we need to make sure that as we put that growth into action, as we bring more housing into neighborhoods that's desperately needed, that we do it in a way that does not leave the community that is there behind. That they are included from the get-go in a discussion not only about what happens to their neighborhood, but what their needs and desires are. Because we really need to sort of approach growth two ways and approach equity two ways. One way is that there are neighborhoods that are in need, whether any action is taken or not. There are needs that have been ignored for the last several decades. So we do need to address those needs, and we can actually create tools that allow us to create capacity for growth in areas that are well served by some of the infrastructure needs there, and in that process create an environment that is not just bringing new people into that community, but working with the community that is in there and addressing their long-term needs. The flip side of that is we also want economic integration in neighborhoods that are historically wealthy but have not welcomed people of low income. And that is sort of the other side of it, where you can harness the market. So, and if we do harness the market in the wealthier areas and let the market cross-subsidize housing and bring people of lesser economic means into those neighborhoods, it frees up the subsidies that the city has to really then work in neighborhoods where we have, the needs are much greater. I mean, the mayor has set aside $8.2 billion just for housing subsidies. We've set aside another $100 million for infrastructure. So we're trying to attack this from all sides. We've included many city agencies in this process. We also think economic development, the job piece is important, because people that are in the less wealthy neighborhoods want their neighborhoods to get better. It's not that they don't want change. They just don't want change that will not address their needs. And one of those needs is really to bring them to a point where they can be more active participants in the city's economy through job trainings, through skills development. So it really is a comprehensive approach to bringing inclusive growth to the city.
Good afternoon. So I agree with and co-sign everything that has been said before me. I don't know if it's possible to go back to the slide that had the map of the city So if I put a health lens on economic growth, we at a public health perspective would say, where you live, work, play, and pray impacts and influences the health that you have. So the jobs that we have, the housing that we have, quantity and quality, what kind of education that was mentioned earlier on the panel, all of this impacts health. But what we're very clear about in New York City is that when we look by neighborhoods, and if we say neighborhoods are 59 community districts, that health is not achieved optimally for all people in all neighborhoods. And so the same neighborhoods that are highlighted here, with an addition of a few more that are in northern Staten Island and Far Rockaway, these are the same neighborhoods that have the worst health outcomes in the city. And so from a health lens, our goal is optimally that we rid our city of the inequities that exist. But that can't happen without all of these other things happening related to housing, economics, and education. And so when I look at and I think about economic growth, I totally agree with that. It's not just about an outcome, but it's about our process of getting there that is really, to me, ultimately important. And so our process, one, in understanding our own power and privilege as institutions, agencies, community-based organizations, of what we bring to the table as people within those institutions and the institution themselves. We have to have a good sense and an understanding historically of how communities and neighborhoods have come to be this way in New York City. They have come to be this way, to be real, is through policies and practices that we as city government have put forward. That's the truth, and that's the history, and we have to be honest about that. We need to elevate that and understand how cities have become segregated in this way. I think that's our responsibility to do that. The second piece, which was already mentioned as well, is in regards to the participatory process. So the idea and the process of engaging voices that are experiencing the injustice greatest. I always talk about, because I do a lot of conversations around movements and how are movements really pushed forward. And the reality is that there's no movement that has been pushed forward or been successful without those who are experiencing the injustice leading that movement and being engaged in that movement. And if we really want to think about economic growth for all people, and we're clear that not all people have that opportunity, they have to be a part of that table. And then it's not just them coming to our table, but we have to find ways to go to other people's tables that we haven't figured out how to do before, we haven't been intentional about, or we haven't cared about doing before. And I also think that we have to be explicit about naming, as mentioned before, race, and that means we have to be explicit about who's really missing at the table. We can't just use the terms community and neighbor. They're thrown around all the time, and it's very confusing, it's not very clear. So we have to be explicit about who is not at our table, who needs to be there, and especially as it relates to race and ethnicity.
So I wanted to actually start by talking about the planning process. And Dr. Maybank, I was hoping we could start with you, and maybe it's a continuation of the things you were just saying, but I know that at the Department of Health, you've been working to incorporate concerns about racial and economic equity into your work. And can you explain in some more detail what that process looks like and how it's affecting, what the challenges are and what the successes have been?
Sure. So should I go through my, I think it's probably best
Sure.
to just read the slides. Lots of slides. But not too many. Usually I have a lot. Okay, so next. That's me. Okay, so the Center for Health Equity is now about 1.5 years old. I've been in the health department 7 years. But when Commissioner Bassett came on board, as was mentioned before, one of the platforms for de Blasio administration is equity. And Commissioner Bassett, who many people know at this point in time, has been very vocal in the need and the importance for us as an agency and us as a city to become very forward and bold in that language. And so the charge that she has for the agency and the operation or the vehicle in order to help put that forward in our agency has been through the Center for Health Equity. And we're really there to amplify the health department's approach, language, lens, all of that as it relates to health equity. But we have 4 approaches to doing that, and what we're very clear about, which is the top one, is that in order to advance health equity in our neighborhoods or in the city, we have to look internally to who we are, how we understand, do we even understand the definition of health equity? Do we know what that means as staff who are supposed to be putting this and advancing this forward? What are our policies and practices that help influence equity, and what has prohibited us from actually really advancing health equity and actually made it possibly worse across the city? And so we're, and I'm going to talk about, I'll come back to that in 1 second in another slide. So that's a big part of our work that we're doing. The other part, just 1 second, go back. The other part is investing in the key neighborhoods. So we have the fortunate opportunity, as many city agencies do, having physical buildings located in neighborhoods that you saw that were dark just a little while ago, that are in East and Central Harlem, South Bronx, North and Central Brooklyn. And there's a whole bunch across the city that were built almost, started over 100 years ago under the LaGuardia administration. But over time, those buildings became underutilized. And so when Commissioner was here the last time, when she was a deputy commissioner, she reopened these spaces to become what they were called district public health offices. And now we're renaming them to be neighborhood health action centers. And to really reimagine the initial intention of these buildings, which was to co-locate, they called it health and welfare agencies, but they also had, city agencies as well. But to co-locate folks under the same roof, so medical providers, community-based organizations, other city agencies, that think about planning for the neighborhood. Think about the neighborhood as a unit and how we can have impact on the neighborhood, not just about delivering services, because that's the challenge with health. People think about health and they think about health care. They think about hospitals and doctors' offices, but health goes way beyond that, and that's part of our role at the center, which brings into the partner with New York City government agencies and community advocates, is how do we put a health lens to all of the work that we know, or the factors that we know influence health, the social factors that I mentioned earlier. How do we partner more explicitly with community activists and organizers already fighting a health fight, if you ask us, are already advocates for justice around health. So how do we partner with that? And then how do we really elevate injustice in a way through our data? We have community health profiles that we actually did a training with many city agencies to share these community health profiles so that they were aware of the health impacts that are happening in their neighborhood, and they were launched for the first time for 10 years. We hadn't done this for a whole 10 years. But it lists social conditions, health conditions within the neighborhoods or within the community district. So anybody can look them up here. You can look up your own community district and see all types of health outcomes for your neighborhood. So I encourage you to do that. So that's part of our work as a whole. So next slide. And I put this slide up because we really think it's important to understand the distinctions between equity and equality. I think the pictures are very self-explanatory, but it's not just about providing the same. Oftentimes, it's been heard that our neighborhoods and our residents aren't starting from the same point. And it's not just about providing the same. The reality is neighborhoods that we know historically have experienced racial injustice through policies and practices need more. And the reality is the disparity is so great. Next. And so going back to the internal reform process, what our inside strategy is to help support our outside work is that we have partnered and we brought on a consultant, the Center for Social Inclusion, who many people may have heard of. It's headed by Glenn Harris, and actually Maya Wiley, who's on council now, was co-founder of Center for Social Inclusion. And so they're helping us support this effort to figure out how to normalize, organize, and operationalize all this internal work. And what that looks like is, one, we had to hire somebody to kind of lead up that process, and she's in the audience right there. So when I leave, if there's any questions, Rebecca Galler, if you can just raise your hand. She's the director of all of this work. She came from Boston Public Health Commission, who has been doing this internal reform process for over 10 years now, probably even a little bit longer. And they're really the leaders in the country with doing this internal transformation to implement a racial equity and social justice lens. And so it starts with leadership, commissioner, going to the deputy commissioners and saying this is the process, and actually sending out to the entire agency an email and saying this is what we're about to embark on. This is the lens that we're implementing. Deputy commissioners have gone through training with Race Forward. We've had a lot of consultants come in, but to understand what are levels of racism. We have implemented now, we have a core team that we call it. A core team is a way to ensure that across all divisions, we have representation within the divisions of people who are connected to this work, and thinking through broader action plans for the agency around the areas of workforce equity, contracts and budget, communications, There's 2 I'm forgetting, but a whole couple of areas within the health department that we have a team working on and are connected. And then there's just an organizational structure that we're developing to ensure really accountability within the agency and then also sustainability, because the challenge, right, is that once administrations change, once this door potentially, or if it changes, I shouldn't say it like that, but if this door closes, we may not have that opportunity again to be so forceful in our conversation or bold in our conversation around race and racism. Because I say before Mary Bassett came on board, we really couldn't say that. We weren't allowed to say that, you know, in our presentations or conversations. So the door is here, and so we're going to capitalize on it as much as possible. And we have lots of learning education opportunities. We have to think through training of staff. At Boston Public Health Commission, it was mandated that all staff receive 22 hours of professional development training as it relates to implementing a racial equity lens. So there are many examples that are out there, or enough examples that are out there. We have the fortunate opportunity to replicate some of that and create our own. We are the largest health department in the urban world, so a lot of people are looking to us to be able to do this and do it well. And then the other opportunity is, how do we work with other city agencies to also think through this work? There's the Government Alliance for Racial Equity, which is a national alliance, and now there are municipalities that are signing on to be a part of this alliance. It's really the organizing effort to build power to do this and implement this in many places and spaces across the country.
Wow, thank you. Really interesting to hear about such meaningful efforts, both internal looking and external focused. So I wanted to ask Benjamin and Joan, as people who've worked with community members and community groups, interacting and engaging with city agencies for a long time. What are the aspects of planning and community engagement that you think are necessary to really implement and facilitate inclusive growth from the point of view of city agencies?
Well, I think inclusion per se is paramount, and I think we're all of us struggling with how to make planning processes that start with the physical reality of the city in the present and project into a future that some of us are nerds and are comfortable with, GIS and architectural modeling and that kind of thing that we can see in our nerdy little heads, but that normal people actually have difficulty projecting themselves into. And so to take work that is conceptually challenging for lots of us in the first place, and then to lay on top of that this can't just be left to the experts. This can't just be left to the people with credentials, whether those are planners and other professionals within agencies, or whether there are other kinds of credentialed nerds and geeks outside of agencies, in the technical assistance world, in the community development world, but that somehow we need to open those processes up, and that there's a lot of tension between wanting to do planning inclusively and well and the urgency of the situation. The city is not only growing in population, not only is our economy growing, our housing stock is being overwhelmed by this tsunami of capital. And a lot of that capital is up to no good. Is not simply there to kind of make an honest return for an honest investment in, upbuilding and upgrading property, but our rent-stabilized housing stock is being eroded by capital that is frankly there with a playbook about how to take buildings and units out of stabilization. So we've got, we're putting out fires left, right, and center, both in the preservation of our existing housing stock, in managing and channeling growth and investment in new housing, and prioritizing investment in infrastructure. So I think the truth is, to do it right, sometimes we have to slow down. Sometimes we have to time and pace the processes so that community members, and especially the communities that have done the worst so far, whose status quo is so far below what we want, we have to time the processes and design them and structure them to maximize participation by those folks. So it's kind of, if you want to get there fast, start slow. And then the other, so inclusiveness, making processes that not only kind of, act like focus groups and kind of harvest language and solicit input, but are not accountable for what's done with that input, doesn't really get us there. That I think the agencies are honestly struggling to find ways where communities are not merely informed or consulted, but are agents in the design of their futures. And that's hard. And the legacy of inequities that we all live with makes it harder. It's still necessary. And finally, there is transparency and accountability. That how do the realities that we're planning for in the future get realized over time, and what are the roles of both people inside government and people outside government, including especially the community-based organizations. They are the keepers. They are the keepers of memory. They know what happened during the age of urban renewal and violent displacement that way. They remember what happened during the age of abandonment and disinvestment. They are holding that memory and bringing it into the discussions that we're having now, and they will be here when us technocrats are gone, and they will be the channels through which members of the communities that need to benefit from the planning we're doing now need to hold future administrations accountable. So I think inclusion, agency, and transparency are the ingredients.
So I agree with everything that that Joan said, but also I actually don't bring the point of view of being a community planner to this, but rather as a community organizer. And sort of a planning process I think is really important. And so I love the concept of inclusive planning. I love the process of the concept of a process that kind of brings in the point of view of the neighborhood and engages them in thinking about what the neighborhood should look like. But I think that in the end, that is only one part of the actual process. The truth is that there are, in the planning process, and we sort of think of this as TA providers in some of these local rezonings, there are facts about what can get built and how much can get built and what it would cost and how the market actually works, how much capital the city has. Those are facts which I think people need to sort of understand and sort of have, have a common understanding of. But the real parameters of planning are often defined by political questions. Right? What is seen as being possible is defined by decades of who has power in the city, in whose interests sort of the markets are shaped, and who benefits. And so you have a process now that's taking place, which is often a very sort of heated one, where the most progressive administration we've had in certainly in my memory. With extraordinarily well-intentioned people, sort of embracing this idea of openness, and yet for all that there is still a lot of tension, because I think in the end there's a lot of communities that see the process as being shaped not by the people who are happen to be sort of in City Hall right now, but rather by the decades and decades of political power imbalance, and they want to redefine the questions they're allowed to ask. And so a proper planning process has some good old-fashioned New York heat and struggle and conflict, and it is our national pastime in New York City to tussle over light and air and space and affordability, and even more necessarily so now that some of these big questions are being thrown open, and we have an opportunity to sort of really redefine what does affordable mean, affordable for whom, why are we rezoning here, and really come up with just a different range of possible answers.
So Purnima, I wanted to give you an opportunity to weigh in on this. I mean, you are at the city's planning agency, and given this political reality that Benjamin has touched upon, what role can equity and inclusion and these goals play in the planning process? And what are the challenges, and what is the goal of the city planning?
So, I mean, planning by its very nature is complex. It's sort of often an art more than a science in many ways, and Benjamin is right. We can sort of look at the facts, we can look at the built form, we can look at how tall, how wide, how deep. And that's a part of it and a very important part of it. But it really is about the people, and it's about the people in these different neighborhoods that we are planning for. And frankly, one of the most difficult sort of pieces of this exercise for, I think, almost everyone at this table who are sort of the professionals, is to acknowledge that we may know the facts, but we are really not necessarily, that doesn't make us know better than what the people in the neighborhoods know. And that is a very, very, it's sort of is challenging to think after all these years of schooling and you know, all our degrees, that we are really sort of, we are not the experts here in that sense. On the flip side, you know, defining who is the community is just as hard. I mean, over these years, New York City has a planning public engagement process that has been mandated by the charter. And you know, in our 59 community board districts, we have community boards that are representatives of the community. And what you often find as you engage in this process that actually does start to sort of throw aside what the book tells you and really engage with people on a more direct level is that there is no one community. There are many different interests and many different asks within a community, and very often a very well-intentioned sort of community engagement may still not reach everyone that you need to reach. And so what to me that means really is that we are all learning as we are doing this. We are all engaging with each other with very open minds about, you know, about the fact that we all need to learn this process together. And you know, what Joan and her group are doing is really sort of being those mediators between the city government and the community in trying to engage voices that may otherwise not be at the table. And we really, frankly, welcome that. The other thing also is, you know, to your earlier point, I think a number of people raised this point, engaging the community in the process and sort of understanding what they need and what their asks are and what a plan may be able to deliver are often not the same thing. And I think that is where a lot of the tension comes in. However well-intentioned, you know, our planning process is and our intentions are, there are realities, there are market realities, there are budget realities, there are, you know, and our challenge really is to work through all of those and to try to make this process as responsive as possible and as engaged as possible with the community.
So thank you. Dr. Maybank, I want to come back to you and ask you, you were talking about the map and health outcomes and the neighborhoods that were highlighted on there. So how are public health problems, you know, both exacerbated or in some instances perhaps helped by economic growth? What do you see there, and what role should health concerns be playing in the planning process as the city makes decisions about where to invest and where to rezone?
Sure. Well, as far as improving or how public health is improved by economic growth, similar to a little bit close to what I mentioned earlier, that clearly, and I don't think it's a surprise to people, but people don't usually frame it in this context, that, you know, if you have jobs in your neighborhoods are safer, you have better education, or the systems are working well for the students, that naturally it's going to support, public health is going to be supported by that economic growth. You know, we would see across that map better health outcomes across the city. That's definitely true, and we're aware of that. And it's hard to separate out one versus, you know, housing versus jobs versus education. You know, it's the cumulative of all of it together that, you know, helps support, or economic health supports public health. What has been mentioned in the challenges is that not everybody gets to experience economic growth, which has already been mentioned on this panel, and that we're clear that communities and gentrification is the term for really displacement, and that people are well aware that they are about to be displaced. That's the real conversation, and that has, you know, effects directly to people's mental health, and naturally to their physical health as well. Economic growth should help support, and it does help to support the behaviors that people are able to have within a neighborhood. So if you have more opportunities for healthy food, or access to bike lanes, or whatever that's present, that creates opportunities for health. Your opportunity index goes up. But again, that tends to be a representation for folks who have been living there for years, who are either low income or are Black or Latino, who just don't have access to that opportunity growth. And how do we look at the health impact or the public health impact of that is a question for us. And it is something that we're trying to look towards, but there aren't many systems or surveillance systems that are really set up to really capture that fully. HPD, Housing Preservation Development, has done some excellent work as of late in the last 2 years of really looking at the health impacts of housing, and they have a great report that's out. But there's a lot to be learned as far as the implications of economic growth, gentrification, displacement, and how that affects the public health of neighborhoods. But we're very clear. I mean, I think without having the data behind it, it's not all about numbers, it's about the stories as well that are present. That affects people. And when people have to move, when people feel like they can't experience their own neighborhoods in the fullest way that other people can who are walking down their streets, yes, we may have neighborhoods in which where there are Black and white people who are living next to each other, but they're not necessarily integrated or coordinated with each other or hanging out with each other, or engaging with each other. There are separate lines or invisible lines, and sometimes very clear lines, that these two are not coming together. And so I think that relationship, that reciprocal relationship, is definitely there.
And I wanted to also ask you about food, since you touched upon that, the access to fresh and healthy food. I mean, there's parts of the city where there aren't enough options, and there are other parts of the city where low-income people can't afford the food options around them and have to, travel to New Jersey.
That's the challenge, economic growth as well, right? We see the neighborhoods that are becoming gentrified and people are becoming displaced. Yes, there are healthier options being brought in, but the challenge is sometimes those healthier options are not as affordable. If we look back as far as policy, there's the FRESH program that was launched under the former administration, as well as the Green Carts program. I mean, we could look to those and say that there's definitely a level of success with those initiatives. We do know that there is greater access to healthy fruits and vegetables in these neighborhoods because there was the intention from using our data, from noticing the health outcomes. There was intention to make sure we focused our efforts in those neighborhoods. It brought hundreds of jobs to people within those neighborhoods. The Green Cart program, it brought the opportunity to become entrepreneurial where it might not have been there before. And from a food justice perspective, it allowed equity, hopefully, and we do believe that. It allowed equity as far as the access to fruits and vegetables within our neighborhoods across the city. So that is, I think those two programs are very clear connections between economic opportunity, growth, and health.
Yeah.
And I think as we work more with other city agencies, I believe those opportunities will continue to be identified across our city.
Great. Joan, I wanted to ask you this issue of what role the city should be playing about and making sure that there's a diversity of food establishments and other commercial establishments. And where is there a role for public policy in addressing the commercial offerings in a neighborhood? And what really should we be leaving up to the market to determine?
I think that's, there is a lot of scope for both public policy and for community engagement to really, intentionally shape what uses are on our street fronts, what kinds of ground floor uses are supported and encouraged. And there are interventions that that can be built into land use planning in terms of being intentional about the size of commercial space and the location of commercial space. And it isn't one size fits all. I mean, you certainly want there to be an affordable neighborhood supermarket along with mom and pop businesses. It turns out that the underwriting of development plays a big role in, the proliferation of chain stores, that a developer who's got one or two commercial tenants that are Dwayne Reed, et cetera, or branch banks is going to look much better to his or her lenders than a developer who has just mom and pops or to be determined. Well, gee, that's a problem money can solve, and that's a problem that city policy can address, as part of a development vision for an area. And the local role is kind of really being the curators and the folks who make those broad brush policies respond to local conditions. I think Fifth Avenue Committee has been outstanding about that. I think, there have been challenges and ups and downs, but Myrtle Avenue in Fort Greene and the work that MARP has done to really encourage, as more wealth and more population have come into that area, to really make sure that it didn't just become a college bar strip, but to really encourage local businesses to reach out to the kinds of businesses that are going to serve the long-standing traditional population. And then another kind of avenue for public policy is literally public space, streets and sidewalks and plazas, and what kind of models we introduce and support and fund that that shape who uses and who creates the identity of the public spaces that are absolutely part of the mix.
Great. Purnima, do you want to address that as well? I mean, what's the role for the city in addressing the diversity of commercial space and establishments?
It's been a debate, as you know. I mean, there are there are people who think that we should be a lot more prescriptive about what kind of commercial establishments are permitted. There is a lot of, very legitimate desire to make sure that the mom and pops that give neighborhoods character remain in those neighborhoods. The question is, how do you do that? It's not that anyone debates the need for that kind of a strategy. Is it, but also I would say that in neighborhoods like, East New York that we just rezoned, as much as there is a desire for the mom and pops to stay there, there is also a desire for a good supermarket to be there. There is desire for a place there where kids can go and, buy stationery and school uniforms and shop before the school season starts. And I think the people who are affected the most when those services are not there are the people at the bottom of the economic ladder, because they don't have the cars to then drive to the Gateway Mall that is sort of, a few miles away. They're dependent on the buses. So this is sort of, a healthy neighborhood needs that diversity of commercial establishments. Maria's not here, but I know in her previous role at the SBS and now at EDC, we've been engaging both those agencies as we've done these neighborhood studies, and the one that we just finished in East New York actually does bring in those. SBS is doing like a whole neighborhood needs assessment with the local business community along the major streets there. And then we are also working with HPD to the extent that city is playing a role in creating the opportunities for economic development, how we can bring those two elements together. It means SBS needs to work a lot harder in making sure that the mom and pops have the capacity to actually compete with some of the other establishments, and that can be done through city policy, and we are focused on that.
What kind of tools does the city have to help with that?
Well, some of it is that if you go talk to many of these establishments, they will not have a good accounting system. They're very used to doing business a certain way, and as neighborhoods evolve and as, there is the desire to get better retail, if the local bodega wants to sort of step up there, we can provide them with those tools, whether it's assistance with getting loans, whether it's assistance with, through the Fresh program that Dr. Maybank was speaking about, that city planning worked very closely with the Department of Health on, where we actually have zoning incentives and financial incentives in making sure that the local supermarkets can stock fresh produce, can have supermarkets that are providing the amenities that the neighborhood desires in a way, So it's not any one solution. There is sort of a role. And I think that's been sort of the big change in the way we are approaching neighborhood planning. We are not, at the Department of City Planning, just going and saying, here is a rezoning plan, and we are done. We really are bringing in EDC, we are bringing in SBS, we are bringing in HPD, we are bringing in Department of Health, DOT, parks, the Parks Without Borders effort, the Community Parks Initiative. We are knitting all of the role we play is really in bringing all these agencies and trying to knit the efforts of everyone together with the community there at the table to see how we can make whatever investment the city is going to put in be responsive to the community. So for instance, in East New York, part of our plan is improving parks and actually creating new park opportunities on land that is mapped as park but is just an asphalt sort of piece of land there. And what we are doing is Parks Department is actually going to sit down with the community rather than come in and say, here is a design for your park, to sort of work with the community to see what is needed here, what are they lacking, what is it that they want to see here, and then plan and design that in conversation. That means it takes a little longer, to Joan's point. We have money set aside for it. There is a budget that has been put into place, but the planning process is not saying, as this plan is completed, here is a plan we are going to build tomorrow, that we are going to work with you to see how we can build it better.
Okay, great. So in our last 20 or so minutes here before we open it up for questions, I want to get to housing. And to think about, obviously, the housing that's available in a neighborhood has a lot to do with how inclusive and available that neighborhood is. And I want to talk about, the city subsidies and how to use them to achieve that goal. But first, I want to talk about the private market. And again, Purnima, I thought maybe I could ask you this question, though, of course, I imagine that other people might have opinions and would love to hear from Benjamin and Joan as well. But part of what's happening in neighborhoods as they gentrify is that there's market interest in investing. So, how can the city harness that? You mentioned that in your opening statement about what an inclusive neighborhood and an inclusive city looks like. But there's inclusionary housing, which I imagine you might want to touch on. But even other ways. Are there other ways of thinking about harnessing that investment and interest in neighborhoods to make them more inclusive as they grow?
So sure. As I guess most people in this room know, we just went through a major sort of text amendment in the last year to put into place the city's first, and we think the nation's most aggressive mandatory inclusionary housing program. And for those of you who may not know what that means is that it's a program that we utilize anytime the city, either by itself or through a private action or through the actions of another agency, rezones an area to create more capacity for residential development. And what we are saying is anytime we do that in mid-density districts or high-density districts, a certain percentage of the housing that gets created would be affordable. And we can debate about sort of what those affordable numbers are, but this is really a process that we think is essential in ensuring economic diversity and hopefully through that racial diversity and socioeconomic diversity in the city as neighborhoods transform. And I think one of the sort of most important aspects of this is that it is really, looking at change that is taking place today without any such requirement and sort of saying we want to change that dynamic, and anytime we are intervening in creating more capacity, we are going to require a certain amount of housing to remain affordable. We have done an extensive study of the feasibility of such a measure and looked at how across the city, different markets could accommodate that as areas change. And I think as Benjamin was alluding to, there are neighborhoods that are able to, through the market's own capacity, cross-subsidize the required affordable housing. And then there are other neighborhoods that are less able to do so, but the city in those instances can work with often the not-for-profit housing producers to ensure that a percentage of that housing becomes affordable. We also think that as neighborhoods transform, the requirement for that MIH would make the sort of runaway land prices a little bit more, bring those down to more manageable levels. As we have done that, we've also done a parallel effort called the Zoning for Quality and Affordability, which has provided really a lot of measures in which affordable housing production becomes less expensive, becomes more affordable, and that's partly through removing unnecessary parking requirements in areas that are well served by transit, where affordable units, including senior housing, was required to provide required to provide parking, often structured parking that costs anything from $20,000 and up per unit, which is, we think, money that can go better into actually creating the housing itself. We've also provided more opportunity for the buildings to be taller or built with more articulation, so that not only can you actually build them cheaper, you can build them more attractive and accommodate the affordable housing more easily. We've addressed the needs for senior housing in through this process by allowing for the first time continuing care opportunities in the city, making nursing home provision more sort of easy across the different neighborhoods, and also addressing needs for supportive housing and special housing through this process. So it's been sort of a process that is that's looking at the spectrum of housing, and then we are doing neighborhood planning studies to make that happen.
Okay, great. Benjamin, do you want to comment on this question of how the city should be harnessing the private market?
So, can I get my first slide up again? So this is really sort of the central question. This is sort of the central challenge for New York City now, right? And it is a hard challenge. So it's sort of like thumbnail history of housing policy in New York City, sort of mid-century. It was largely federally backed, right? There was sort of federal subsidy that went into creating, sort of publicly backed public housing that was sort of available for a range of incomes, including down to sort of the lower ends. The city was not primarily in the sort of the affordable housing development business. Sort of with the sort of the physical and social distress of the 60s and 70s, by the time the Koch plan came around, there was about 100,000 units of effectively vacant and abandoned and highly distressed city-owned property, which was originally an albatross around the neck of neighborhoods, and then with sort of the push and the political will from the community development movement and the the partnership with Mayor Koch, began to see those as not as an albatross, but as an opportunity that you could sort of create. You could sort of create a really robust federal tax credit pipeline to allow all those buildings to be rehabilitated and turned into what has become the critical mass for the social and physical revitalization of tens of neighborhoods around the city. By the end of the sort of the Dinkins years, most of the city-owned affordable housing had already been developed, and so correctly now, much of the energy of the there's a little bit of city-owned land left, and they should use that with permanently affordable sort of mission-driven developers to really guarantee the long-term benefit. But necessarily, much of the energy in our affordable housing development projects must come from incentivizing the private market. And there's sort of two primary ways the city does that. One is through inclusionary zoning, and then one is through real estate tax abatement policy. What's the 421A real estate tax abatement? So the question there is really about the choices the city makes, right? And sort of looking back at that graph, and again, sort of the political questions, right? So it had always been sort of assumed that you could only build housing sort of that was mostly centered around 60% of AMI, right, which is about $1,300 a month, but in rent. But if you sort of look at that, you can both see where the population is clustered. If you look at that through through a racial lens, 49% of all New Yorkers earn below 60% of area median income. 58% of African American New Yorkers earn below 60%, and 68% of Latino New Yorkers earn between 60% of AMI. So part of the reason that there's been so much community sort of tension around these issues has been that they really see a very sort of direct equity impact from how and what gets built. So the question is sort of the trade-offs that the city makes. So you can do if you're cross-subsidizing housing, right, there's no reason that you can't do fewer units, but at a deeper AMI in the neighborhoods where that's appropriate. And the administration, again, is correct to say that the mandatory inclusionary they rolled out is the strongest and the best in the country, by a significant margin. But there's a lot of communities that are concerned that don't feel that it had gone far enough to meet their concerns, particularly about getting to where the bulk of that population is. Again, recognizing that that used to be the Fed's job, they kind of backed out of it, and now it's our job, but it's not a job that we can ignore. You can cross-subsidize, right? You can sort of take inclusionary zoning and you can take a somewhat less affordable total number of units, but you can get the affordability levels low. You can also, and I'll only whisper this, you can dampen the market a little bit, right? You can sort of not take the assumption that the Real Estate Board of New York has, that you can do anything you want, but you absolutely can't stop any building from getting built anywhere ever. You can say, it is more in the long-term interest of our communities to set requirements that dampen some of the energy of the market, but return for the community much more of what we want. And this kind of gets back to the original political question of you need organizing in the space to sort of to reimagine what are the questions you can ask, kind of what are the parameters of what's possible, and sort of making sure that that the private market runs at absolutely sort of full tilt everywhere. Maybe that's the right thing, but in some neighborhoods that's not, and that should also be on the table to get to more of the affordability levels. Similarly, with the 421A abatement, this is how you structure it, how much the percentage of affordable units, and how deep the affordability, and where you risk, sort of lowering some of the heat in the market. Those are questions which really could be addressed without automatically internalizing the assumptions of the real estate lobbying entity, which has been much more. This has been less a problem with the city administration, much more an Albany problem, which has a particularly difficult problem not thinking, like the real estate lobby does. So these are sort of those are sort of the key questions. It's easy to sort of think in this room abstractly about this stuff. When a lot of the folks in the neighborhoods that we work with think about this stuff, they think about Steve Croman, right? They think about that landlord who was arrested last week because he was buying tens of buildings in neighborhoods that he can transition, and was very aggressively pushing out low rent paying tenants. He sort of jumped 2 feet over the line of legality into genuinely illegal harassment. He is an extreme example. He's sort of easy to point the finger at, but the truth is that there are all the tools in his toolbox are tools that many landlords around the city are using, just not to as extreme an extent. But the communities that are sort of seeing all this development, all of this private market energy that is focused, that is a little bit creative, but is geographically focused by city rezonings, by sort of city tax policy, they see sort of Steve Croman-like tactics. Just as one thing the city can do, Steve Croman, just in the last 2 years alone, got 324 buildings permits from the Department of Buildings to do substantial rehabilitation in apartments that he had vacated through harassment. And that's the key mechanism of his business strategy. And so one thing the city could do, sort of talking about city options, is to create what's called a certificate of no harassment system citywide, where if there's a credible accusation that you have gotten that vacant apartment through harassment, you can't get that Department of Buildings permit that people like Steve Croman so rely on.
Joan, I'd like to ask you about this question about the city's subsidy dollars and how the city should think, putting aside the question of what the private market is doing, how should the city think about spending its dollars in pursuit of inclusivity and in creating inclusive communities, given that there's the demand for housing subsidies far outstrips the supply, and it's much more expensive to build or preserve affordable housing in high-cost neighborhoods.
Yeah, absolutely. Well, I'm going to, acknowledge the incredible milestone that the enactment of mandatory inclusionary housing represents for New York City, and that it's the fruit of really hard work, by the agencies, by, years of research, both by the agencies and by advocacy organizations outside of government, of which ANHD is not least. So it's a huge achievement. Any other city with pretensions to an equity agenda, bring it. Come on. Still, because it relies on leveraging the very market forces that are driving up the cost of housing, there are limits to what it can do. There are limits to what we can accomplish through MIH alone. And as we've seen, it's difficult to, it's difficult to leverage market value without also investing considerable subsidy through, to use MIH in the low-income neighborhoods where, to date, rezonings have been rolled out. So one direction, obviously, that, that I think the city is looking to go is MIH in more affluent neighborhoods. Like, when do we take advantage of the real force of that market in places where MIH can work as designed and, and really leverage deep affordability without draining city subsidies? So I think it's, it's interesting to look at the map of the areas that are under study for rezoning now and imagine maybe neighborhoods that might be added to that list that could bear more development and that would make effective use of the market. But the really brutal fact is we can't build our way out of the affordability crisis. We have to preserve our way out of it. That the number of affordable units that we're losing every year to practices like what Benjamin described just dwarfs what we can produce through MIH, through subsidy, et cetera. And I think a service that community organizations have done in the neighborhoods that are undergoing rezoning and studies right now is to keep surfacing that issue of preservation, and that a partnership between all of the kinds of organizations that are surfacing and care about that issue and city government might look like, a discussion of what can city government do, what do we need the state to step up and do? We can't strengthen the rent laws the way we need to without the state's cooperation. We can't change tax policy in the ways that we need to without the state's cooperation. There are also strategies like the anti-harassment certificate that, that can be implemented at the city level, but that need resources. And the agencies may not have, kind of the political standing to command those resources on their own. That's where partnerships with the communities and the organizations and the advocates in those communities comes in. That there are, I have the rock, paper, scissors theory of government. The rock fears being covered by the paper fears being cut by the scissors, and the scissors fears being broken by the rock. You can reverse that. You can use those power relationships to your advantage. So, paper, of course, is the agencies. Scissors, of course, are the elected officials, okay? And the rock, of course, is the power of the people.
All right. Well, on that note, it's an excellent analogy. We're going to open it up to questions from the audience. So, is anyone out there? And we have a mic, I think, if people... Okay. Questions? Yes?
If you have a question, hold on, I'll bring this over to you.
Thank you. Gib Vacconi from the Prospect Heights Neighborhood Development Council. When we talk about engaging the private sector to create affordable housing through rezoning, how do we deal with the challenge of what happens in the time interval between when a rezoning is announced and when the first affordable apartments actually get delivered? Probably most people have heard that the first affordable apartments at Atlantic Yards have just entered the lottery. That project was announced more than 12 years ago. And in that interval, there's been, effectively, the pressure on commercial and residential rents began immediately after the announcement of the project. And there's been, I would estimate, since 2000, maybe 20% of the minimum of the population of our neighborhood that has been displaced. So now we have affordable apartments that, to a large extent, are addressing a local crisis in affordable housing that the project itself may have helped to create. It's not the only example. East New York was announced 2 years ago, and land costs there have skyrocketed in 2 years. So how do we deal with that time problem if we're going to use tools like MIH to overcome a part of the affordable housing crisis?
So I think that's an incredibly important question, actually, and it's both a time problem, right, because you do want to have the new affordable units built, but it's also a broader problem because bringing in a critical mass of new market rate housing often creates a very destabilizing effect on the existing affordable rent-regulated housing, right? So it is unquestionably true that there's a lot of New Yorkers coming, and so our city is growing, and that we overall we need to increase the supply of housing everywhere, except for the very, very tippy top. But overall, housing is sort of good for the city, with a growing population. But it's also true that where most of the new housing is being developed, right, sort of in those neighborhoods where the sort of the market forces are allowing much of the new development, it is focusing the displacement pressure on neighborhoods that are often most vulnerable to that displacement. So if you look at East New York, right? So, the rezoning only just happened, but we've begun to kind of map out some of the land value change, and the speculation in East New York started a couple years started even before the actual announcement. It starts long prior to the actual moment when the rezoning becomes official, and that is both very true in residential and is doubly true actually in industrial land. Right, we sort of didn't have a chance today to touch on how important sort of land use and city policy is around for equitable economic development, but the city is sort of is helping to unleash these forces, and it is really incumbent on the city to help to shape and to sort of channel those forces in a way that it helps to stabilize neighborhoods. And the answer is absolutely everything that the city can do and more. Right, we're in this tough situation where we have rent stabilization for much of the housing stock in the city, but there are loopholes in that you could drive a truck through, so we don't need to be in Albany trying to change that. But there's a lot more that the city could be doing to make sure that they are as aggressively as possible and as effectively as possible going after the bad landlords, the certificate of no harassment policy that I mentioned. One very good thing that the administration has done is they have put a significant amount of resources into legal services attorneys in the footprint of the rezoning, which has had a pretty big impact. That has mattered, right? Sort of that combined actually with a new one-shot deal policy where the city is much more free in helping people to get a one-shot income grant to stay in their apartment has been very effective, but it's still drawing a chalk line around the body, right? You're still sort of unleashing these forces of displacement, focusing them where the population is most vulnerable, and then trying to sort of alleviate some of the symptoms. More important is to sort of have a proactive citywide approach. The real answer is in Albany. But there is a very meaningful set of things that the city could be doing, including certificate of no harassment, some other Department of Buildings changes.
So, I would say that we have really been focused as much on preservation as we have been on new construction, and HPD and the administration generally has come up with several different strategies, the tenant support unit being one of them, the legal help that's being offered to tenants that are being harassed being the other, and really HPD is looking sort of building by building at everything. The buildings that are in a regulatory program are easier to deal with because they can sort of be extended through the regulatory programs. The challenge really is in smaller homes where there may not be rent stabilization, or the sort of vast affordable housing stock in 1 to 5 unit buildings that exists across the neighborhoods. And HPD is thinking out of the box in those areas and going in with sort of energy retrofit options where they offer energy retrofit funding in return for keeping the buildings affordable for a period of time. The administration is focused on providing seniors and other low-income people with water charge exemptions, energy exemptions. So we're looking to do everything we can within sort of within our control to address that issue. But as you've heard, some of these things are outside of the city's control, and frankly, the fact that there is no federal funding coming for housing is another huge issue. Cities can do, New York City, being at the economic stage it is today, can afford to put all of this money, the subsidies, the funding for the infrastructure as we do these developments into these neighborhoods. But really there's a limit to how much the city is going to be able to do on its own, and we do need partnerships from Albany and from Washington, D.C. to be able to do this in a way that is really meaningful.
Thanks so much for this great panel. I have two questions for Purnima. One is, I think all three of you talked about the importance of cross-subsidizing by rezoning wealthier neighborhoods. And I feel like I'd love to hear you speak to, does the Department of City Planning, is it thinking about that? All 7 of the neighborhoods mentioned so far targeted for rezone are mostly low-income neighborhoods. So I think a lot of people are wondering, why not? Why not look at these wealthier neighborhoods? Is it because there's political resistance there? So I'd love to hear you both explain if there's looking towards the future, as well as sort of what might be the difficulties. And my other question was just also like with sort of what has, so you mentioned lessons are always being learned through the community engagement process. And I'm curious, in East New York, there was a lot of organizing that, they came up with their whole plan, and I know there was a lot of negotiating and working with the coalition there. And I'm curious, now in the Bronx, the scope hasn't even come out, and there's a group there that has this huge comprehensive plan. So I'm just curious, is DCP's method of working with these groups changing at all? And if you could speak to that. Thank you so much.
Sure. So as to looking at neighborhoods that are wealthier, I would just point out that the 7 we've announced are not all low income. I would not call Long Island City, with what's happening there, a low income neighborhood. I would not consider Bay Street necessarily a low income neighborhood. So we are looking, more broadly. We continue to work with many different neighborhoods in coming up with strategies to address issues of growth, rezoning, and I think to the point that was raised about sort of making announcements ahead of being ready to do these things, we are being very careful about not going that route. But I think as you will see, there are many different neighborhoods we are working in. We are also looking at private applications, since the adoption of, or even prior to the adoption of mandatory inclusionary housing, we've gone through several private applications that are currently out there in the public process that are creating over 4,000 units of affordable housing. About 1,100 out of those would be mandatory inclusionary housing, which is permanently affordable. So they do not run out after 25 or 30 or 40 years of a regulation. And I think, as many of us have said many times, and I should reiterate now, we look upon MIH as the floor, not the ceiling. This is sort of the minimum that we expect as neighborhoods change and as new development occurs. In instances where the city puts its subsidies, we will get either more or deeper. And one of the things, I think, to Benjamin's earlier point about sort of going, getting less housing but getting deeper affordability, I think your chart did not show sort of the 4th option that was added to MIH, thanks in big part to the advocacy of a number of housing advocates, which does create that option. It's 20% of affordable units at 40% of the AMI, which we think is about the lowest we can go without getting into supportive housing means. And that is another option that is available in the mandatory inclusionary housing program. So each time we are going to sort of say, wherever the city is putting its money, in East New York, for instance, the first 1,200 units of housing that will be subsidized by HPD will be 100% affordable, and a significant chunk of that will be at the 40% AMI. So the other thing I want to reiterate also is that the need for housing is at every level. I mean, it's, as Jessica's research showed, that the biggest decline has been at that 80% AMI, which is about $67,000 for a family of 3. And I think our program is really meant to work to address the needs from the 40% AMI all the way up to 120% of AMI, which is about $93,000 for a family of 3 in the city. And that can be 2, working parents, a postal worker and a school health aide, or, a teacher and a healthcare worker. I mean, there is need at every level. To the extent we can get the market to provide some of that housing through cross-subsidy, we can then use our dollars to go deeper, to do the supportive housing piece, to do housing for communities that are not going to be served through this program. This is not the only tool that the city is using. Our supply of city-owned land is limited, but we are looking at every single parcel of land that we have anywhere in the city and trying to see how we can leverage that for affordable housing. And I'm sorry, your second question was?
Thank you. It was about sort of what lessons learned from community
Yeah.
engagement, Jerome.
I mean, we are, one of the lessons we've learned is, as Joan pointed out, that we don't want to rush into these things. So we are taking our time in Jerome to make sure that we can actually engage more with the community. And as much as, the community plans are a very important tool for not just informing the city about what the community's aspirations are, we also look upon those as, or what we hope will happen is that those community engagement plans at the community level and through the advocacy can actually bring in different voices to the community. Ultimately, it sort of is we're going to have to look at what do you gain by doing certain things and what do you lose by doing certain things. So there's a balancing act that takes place. And I think one of the lessons we've learned is that where we can be helpful is in laying those options out and sort of engaging with the community in understanding what does it mean if we go deeper in affordability, in the total production, in what does this mean for who can produce that housing and how that can be affordable. Is it more desirable to reach 30% of the AMI for a very small number of units? Or is it better to reach 60% of the AMI for a larger unit, or a higher income for a much broader population? Or what combination of those 3 might be appropriate in some neighborhood? How does the economic development strategy come in? What does it mean to protect the existing businesses versus creating opportunities that might be broader, that might disrupt what is there? But is there a way to then harness that disruption to continue to keep those people in the community, perhaps in new businesses? So there is a lot, that's out there. Our role really is in sort of going to the community and being honest and open about the options and saying we can have an honest conversation about what is really important to this community, and then how can we put that into a framework that can then be a neighborhood plan. The other thing we are doing is being very transparent about what our commitments are. So we are setting up a website that is listing every single commitment we've made with timelines associated with it so that we can be held responsible for delivering those, whether that's open space, whether that's streetscape, whether that's a new school, whether that's a new youth facility, daycare centers. Everything that we are promising in a plan, we are holding ourselves responsible for, and we hope you will all hold us responsible for those as well.
Thank you. I have to say, I'm a little bummed out that Dr. Maybank isn't still here, because I really wanted to ask her questions.
We have a colleague.
Oh, okay. Okay. We'll talk after. But just to say, her voice and her framing, I think, was really welcome. I know and have heard all the folks here on this panel before, and it's good to hear you all again. But I think Dr. Maybank really put some things into a necessary perspective. I want to just build on some of these comments about the effect that these land use actions have on housing affordability. And just as sorry, I should introduce myself. Dave Powell, Director of Organizing and Advocacy, Fifth Avenue Committee. Myself and my colleagues spend a good deal of our waking lives trying to prevent evictions that are often the result of some of this growth. And the effect of the rezonings is, I think, really important to pause about, because this is not just the market, right? This is a government action, right? So this is a time where value is being created. It's not just happening organically, in quotes, and that value often has the effect of, as some panelists have mentioned, eviscerating all of the affordability by many magnitudes more than we could ever possibly help to build. So I just, we're honoring the East New York groups that fought the good fight tonight. I'm not going to speak for them. I'll let them speak for themselves when they receive their reward. But I just want to ask Director Kapur, subsequently, including neighborhoods that might be closer to home in our part of Brooklyn, should they be slated for rezoning, if DCP is willing to, as Joan said, slow down and actually wait for some of these tenant protections and neighborhood-based protections to be put in place before it rezones the neighborhood, because respectfully, the response from the city thus far has not been adequate. It's been a Band-Aid on a much larger problem. And I just want to put forward that I think the floor, as it were, should be preservation, not whatever we can get out of MIH if we're losing at many more magnitudes what we have. And just want to, really genuinely ask you, Director Kapur, to, if you're willing to wait for the passage of the Certificate of No Harassment legislation, the Department of Buildings reform, some of the things that the tools that we don't yet have that would protect people in the smaller homes in East New York, such as a Good Neighbor tax credit program, before we unleash the dragon, as it were, through a government action.
So I think we are taking our time in making sure that whatever actions we are taking are well considered by the communities where we are doing these things. I would just, respectfully disagree with you on unleashing this beast, because I think the beast is out there. Without the rezonings, many neighborhoods are facing, the disruptions of the market forces coming and taking over. And we really think in East New York, we were as focused on preservation as we were on the creation of new affordable housing. The tenant support units are out there working. Any process we engage in, as you know, is a long-term process. We are not yet even at the scoping for the next, rezoning. From there is a very long period. We have a charter-mandated 7-month process, that is the Uniform Land Use Review process. But even before that, we have a scoping, we have comments on that scoping. There is a really long timeline. So it is a timeline within which many of the elements you are proposing could fall into place. But really, if we do nothing, I don't know that actually leads to the preservation of housing.
But respectfully, just to be clear, I'm not doing anything. I was talking about taking proactive action.
And we are. And we really think that, MIH is one of these proactive actions, actually, that will ensure that this is not, the rezonings where we're letting the market just run amok.
Respectfully, entry into a housing lottery does not prevent you from leaving this place from here. It's a lottery.
Agreed. I think it's both. I don't think that we can stop building. We need to build. We have to build. We've got, many people waiting to get into it. If you don't create a new supply of affordable housing, we're not going to be able to solve the problem. I completely understand that is not the only solution, that we need to do both preservation and new construction. And I think we agree on that.
Michelle, do we have time for one more question? I want to make sure that, because I think we're very close to being done.
Maybe somebody could talk about the circuit.
Okay, Michelle, you can ask a question.
So I think Dave's point really speaks to the timing of the cert for no harassment, and I think all the panelists can probably speak about this, about where the status of the conversation is. What are some of the fine points that are being debated specifically about it? How does that compare to the existing policy that's in place in certain neighborhoods? What are some of the most effective things? I mean, I think several folks can comment on that.
Again, right, so the certificate of no harassment concept is something which I think a lot of folks feel could really have a meaningful impact. So again, Steve Furman in the news last week for sort of engaging in such egregious harassment that he was arrested. And again, the key mechanism, he was trying to get tenants out of his apartments because he wanted to get a vacancy, because when you get that vacancy, you can do what's called an individual apartment improvement rent increase, a loophole in the rent law, and then you can jump the rent from $800 to, $2,700. Sort of it's a very cost-effective way to push through the ceiling of rent regulation. But there's a key trigger in there, which is to do all that work, you very often need to get a Department of Buildings permit. And in other neighborhoods where there has been a sort of a certificate of no harassment, so there's been a couple neighborhoods where it's been tried, where there's some oversight and some essentially a filter is created where if you are applying for a Department of Buildings permit, you are first kind of filtered through a system that looks to see whether or not you have engaged in harassment. And if you have, you then have a much harder time, or you are denied getting that Department of Buildings permit. And the key thing there is not its punitive nature on the landlord, although punitive is nice for some of these people, but rather that it is a proactive way of shaping the market. It says to those landlords who are speculatively buying buildings with the assumption that they can push out low rent paying tenants, it says to them, we're going to interrupt that strategy. It pushes down the speculative impulse in the neighborhood. The problem with sort of all of these policies is that sort of if it's sort of just done zoning by zoning, we're sort of chasing after where the speculation is, where the rezoning is, where the market pressure is. A citywide system would sort of put an umbrella over the whole city and create sort of this proactive downward pressure on some of these worst speculative abuses. This was a very important thing that a lot of that community groups got as a commitment from the de Blasio administration coming out of the mandatory inclusionary negotiations, and they've committed to a process of working with sort of a collection of actors around the table to negotiate the details and put it in place. And I think if we can get it right, and I think we can, because it's a great model out there, it can have a pretty meaningful impact.
Okay, I think we are out of time. We're getting the end sign. But please join me in thanking all the panelists for being here. And thank you to you all for coming.